My screening talk didn't go very well the last time because my wireless mouse and the battery started to not work. So I've just included some of the last ones and updated. So with regards to the pandemic in Japan, we're on our fourth wave. We've just had issues with the Kent variant coming in from the UK, despite the fact that Japan has closed all its borders and did have a 2-week quarantine for everybody. So we're on our fourth wave, but if you look at it in comparison to Europe, the cases have been very low in Japan. And as you can see, the deaths, there's less than 10,000 deaths from COVID. And despite where we have the Olympics in 100 days, but they haven't really started to they're just starting to vaccinate now, but less than 1% of the population has been vaccinated. So screening in Japan, basically, it's cytology with ASCA's triage. It starts at age 20. There's no upper age limit, and it's recommended for every 2 years, but actually you can, I go every year because I have a gynecological checkup, and they just do it anyway. So it's basically up to the woman. It's opportunistic, and they've been very against HPV testing, but we've got new recommendations that came in last year. They haven't been approved by the Ministry of Health, Labour and Welfare, but they want to continue with the screening that they have now that's been given a grade A, but that will stop at age 69 because there's no upper age limit at the moment. And Japan has a super aging population. So you've got women in their 90s or over 100 coming for screening. HPV primary, they're recommending from age 30 to 60 years, every 5 years, and they're giving a grade C to co-testing. They're not they're very nurses can't do pap smears in Japan. It's only doctors, so they don't allow nurses. They're quite totally against self-sampling. They say there's no evidence, and the triage strategy has not been decided yet for an HPV positive woman. So screening, you can be screened by your local government. They have a mobile screening bus that goes around like the breast screening in the UK. You can have it done by I have it done by my gynecologist. There's no primary care, so there's no GP system in Japan. You can have it done as part of your workplace health checkup, but that normally only covers women 30 years or older. You can have it done on a private healthcare checkup. And the most common screen in Japan is during pregnancy. And actually, women are getting pregnant at between 30 and 35 in Japan. And we have loads of cases of invasive cervical cancer or CIN3s being diagnosed at the same time. And uptake is low at 30 to 40%. So the effect of the pandemic, the only really effect, we haven't had any lockdown. It's against the law in Japan to have a lockdown. So we've been asked to stay at home, but people are still going to work. We shouldn't go out and eat with other people that are not in our family. So we didn't have a strict lockdown, but from April to June, they did have what was called a state of an emergency. It was like a soft lockdown. So the mobile screening units were stopped then, and capacity was also halved due to social distancing. We've had no issues with consumables or reagents because there's no HPV primary testing, and screening is quite low, and there's no mass COVID testing. And they have a curtain. If you can see here, there's a blue curtain. They put the curtain down so women don't see what's happening and the doctor doesn't see the woman. So they say that helps. There's no full PPE during colposcopy either, because they say they've got the curtain and nobody's talking, so they don't need full PPE. So the studies that are going on, basically at the moment, there's 2 studies. They're just like the European studies, like the Pobascam or the Artistic or Sweet Screen. They're just comparing cytology versus co-testing. The follow-up has now finished for both this trial and another one, so they should be giving the results. But it's just cytology against co-testing. We know that it works, but they want data from Japan. They don't just want European data. So there's another one. It's just the same. And they've just published their first round of results recently. And then one study that I'm involved in, I couldn't I wasn't really involved in the design initially, but I'm now involved in analysing the data, and that is looking at a triage strategy. And basically what we're interested in is looking at whether we should do what Australia does with a HPV 16, 18 triage straight to colposcopy and the other 12 types, waiting 6 months or 12 months, or doing an ASCUS, doing the HPV positive cytology triage like in the Netherlands. So that's my talk. And so what happens in Japan, we can't have a legal lockdown, but you have government officials and policemen standing at the station telling you to stay home at night time. Thank you.